Today, we're diving into a real medical mystery. It's a story that doesn't start with a clear diagnosis, but with a puzzle, a really critical communication breakdown happening deep, deep inside the human body. So let's frame it like this. Imagine your brain is the CEO of a huge company, right? And the pituitary gland, that's the main factory floor churning out all the essential hormones that keep everything running smoothly. The question is, what happens when the phone line between the CEO and the factory is just cut? Let's find out how this exact scenario played out in a real-life case. All right, our story starts with a newborn baby. And right from the very first moments of life, it was painfully obvious something was wrong. A whole cascade of confusing, frankly alarming symptoms sent doctors scrambling to find some answers. First thing, right out of the gate, the baby had these really dangerous pauses in breathing. That's called apnea. And it wasn't minor. It was so severe that they had to intubate immediately just to keep the baby breathing. This was the first major red flag. Okay, so on top of the breathing issues, then came jaundice. Now, a little jaundice is pretty common for newborns, but this was totally different. It was persistent, sticking around for 28 days. That's way, way longer than normal. Another weird piece of the puzzle. And just when you think it can't get more complicated, just as doctors are grappling with all of this, the whole situation escalates. The baby starts having convulsive seizures. So now the mystery is getting deeper, and you can just feel the clock ticking. So let's just step back and look at the whole clinical picture here. What did the doctors see? The baby was born full term, which is good, but there were these unusual signs: coarse facial features, a tongue that was larger than normal, and, this is critical, something called an omphalocele. That's a defect where organs are actually protruding through the navel. Now, the key takeaway here, the big clue, is that this is a midline defect. That suggests the problem might be tied to the body's central line of development. So you've got this collection of symptoms that, on the surface, seem totally unrelated. The medical team had to start this urgent investigation, basically trying to connect the dots between the breathing problems, the jaundice, the seizures, and these physical abnormalities. How did it all fit together? And this timeline really shows you just how fast everything went downhill. The first month of life was just one crisis after another. Day 1, born with apneas, needs intubation. Week 1, surgery for the omphalocele. Week 2, the seizures start. And then by week 4, the baby's condition becomes absolutely life-threatening. Yeah, life-threatening is not an exaggeration. The situation got critical. The baby developed dangerously low blood sugar, that's hypoglycemia, low calcium levels, and then went into full-blown septic shock. This wasn't just one isolated problem anymore. The entire system was failing. The root cause had to be something really, really fundamental. All the standard tests, they weren't giving any answers. The medical team realized they needed to look deeper to get a picture of the command center itself. And that's when they had the breakthrough. After trying pretty much everything else, the doctors turned to a brain MRI. They had a hunch the problem might be starting in the body's master control system. And what that single image revealed, well, it would finally connect every single symptom and solve the entire puzzle. And boom, here it is. This slide just lays it all out perfectly. On the left, you see what a normal pituitary structure looks like. On the right, that's the patient scan. And you can spot 3 massive differences right away. First, the anterior pituitary was hypoplastic. That just means it was underdeveloped. Second, the posterior part was ectopic, which means it was in the wrong place. But the biggest one, the most important one, is that the stalk, that vital connection, that phone line we talked about, was completely missing. This is the classic textbook trio of signs for this condition. And this condition has a name. It's called Pituitary Stalk Interruption Syndrome, or PSIS for short. So let's go right back to our analogy. PSIS means that the phone line between the CEO and the brain, the hypothalamus, and the master factory, the pituitary gland, was cut from birth. The factory just never got its instructions. Okay, so now that we have the diagnosis, we can finally see how this one single anatomical issue caused that whole cascade of what seemed like totally disconnected symptoms. And this table right here, this is the big aha moment. It all makes sense now. Without that stalk, the pituitary can't release its key hormones. So no ACTH means no cortisol, that's the body's stress hormone, and that leads directly to the hypoglycemia and jaundice. No TSH, that means no thyroid hormone to regulate metabolism, which explains that really prolonged jaundice. And no growth hormone also adds to that dangerously low blood sugar. Suddenly, all those random puzzle pieces just snap into place perfectly. So what actually causes this? Well, that's still part of the mystery, really. For the vast majority of cases, we're talking like 95%, the exact cause is unknown. It's thought to be some kind of issue with how the organs form before birth, and it's almost never hereditary. They only find a specific genetic link in a tiny fraction of patients. The diagnosis, it's devastating to hear, but it also provided a really clear path forward. If the body can't make the hormones it needs, well, the solution is to give them to the body directly. And that treatment is a lifelong plan of hormone replacement therapy. This means giving the body the missing thyroid hormone for metabolism, the cortisol it needs for stress and blood sugar, growth hormone for development, and then, later on, sex steroids when puberty is supposed to start. So by manually supplying all these hormones, we're basically creating a workaround for that broken communication line. We're giving the body systems the chemical instructions they were never able to get from the pituitary factory. And for our patient, this meant a dramatic turnaround. It meant the chance at a healthy life. And really, the most important takeaway from this whole story is this. With complex conditions like PSIS, timing is everything. Catching it late can have devastating, dangerous consequences. But as this case shows, getting the right diagnosis early, wow, it can completely change the outcome and give a patient a vastly improved quality of life. And that kind of leaves us with a final thought, doesn't it? This entire complex case was solved by a single MRI scan that showed a truth that was totally hidden from every other test. It really makes you wonder how many other medical mysteries out there are just hiding in plain sight, just waiting for that one key image to solve the puzzle.